Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. In this presentation, we are going to look at what is a nuclear stress test, how do you prepare for a nuclear stress test, what are the steps involved in doing a nuclear stress test, how the test is performed, how the images are obtained and interpreted. So you'll get the entire overview of what a nuclear stress test is. Generally speaking, a nuclear stress test can take anywhere from 3 to 4 hours. You need to be fasting before you come for the stress test. Make sure that you bring all your medications with you so that you'll be able to take your medications after the doctor instructs you. So once you arrive at the place, the first thing they will do, the nuclear stress test consists of two parts. One is a treadmill exercise test or a chemical stress test where we stress the heart with exercise or with medications to improve the blood circulation and see if there are areas of the heart muscle that is not getting adequate blood supply. The second part is the nuclear scan, which is used to take the images of the heart because you're injected with an isotope before the exercise and after the exercise. And that isotope is picked up by the heart muscle, which is going to be converted into images, which will help us to learn a great deal about various aspects of the heart in terms of circulation, disease, heart failure, and many other things which I'm going to be talking about in a minute. So we start an intravenous line, then you're hooked up with all these electrodes on your chest, and you're hooked up to a monitor where your EKG, blood pressure are recorded. Then you walk on a treadmill, or you can be just having a medicine given to dilate the blood vessels, that is to improve the circulation to the heart muscle. The images are acquired. These images are processed, as you can see here. They are sliced into 1 centimeter thickness, and they come up like a donut, or it's like a V-shaped. They're going from the tip of the heart to the base, and again this is going from one side of the heart to the other. In this way, we can look at heart from multiple angles, and we also have what is called the target view, which I'm going to show in a minute, which can be used to look at the overall circulation to the heart muscle. And here is an example of a blockage in an artery that is causing reduced circulation to this area of the heart muscle, and this is during exercise, and at rest there is complete restoration, maybe not complete, but almost complete restoration of blood circulation. So this is a positive stress test, and it is involving a large area of the myocardium. These are the patients who need further investigation, such as cardiac catheterization or maybe even stent placement if there's a critical blockage. And here is another example of a CAT scan, an angiogram, and a nuclear stress test. As you can see, there are some blockages here. We can see there's a blockage in the angiogram, there's a blockage here in the arteries coming to the front of the heart muscle that goes all the way to the apex. And here is the blue, means reduced circulation. This is during exercise stress, and this is at rest. There's some improvement during the rest, but still there is some reduced circulation even at rest. And this is something which can be identified with the nuclear stress test. There are several advantages to doing a nuclear stress test rather than sending everybody for a heart catheterization. So let's look at some of the advantages that we have with the nuclear stress test. It helps us to determine your exercise capacity. Number two, it identifies reduced blood circulation to the heart muscle or regions of the heart muscle. Number three, it will help us to identify previous heart attacks which show up as scars at rest and during exercise, the blue color which I talked about. It will help us to assess the overall heart function, which we call as the ejection fraction, so we can measure if this patient is in heart failure, how serious is the heart failure, is there an enlargement of the heart, and is there thickness of the heart, is there scarring of the heart muscle. All of these can be determined with the nuclear stress test. Then we have an overall heart function which can be assessed by looking at the circulation, looking at the heart size, looking at the heart function, and also looking at other structures around the heart. In many cases, the nuclear stress test is combined with a CAT scan, which helps us to identify the presence of calcium on the coronary arteries. This has become a standard procedure in many institutions where they have a combination of a nuclear scan and a CAT scan combined together so that they get both images one after the other and look for any evidence of coronary calcification, which sort of adds to the diagnosis of all the other things which I just talked to you about a minute ago. So ladies and gentlemen, in summary, the steps are you come to the doctor's office, they start an intravenous line, they either give you first they give you the isotope, then they give you get resting images. Afterwards, they can give you the medication or put you on a treadmill and do an exercise test. At the end of the exercise, whether it is chemical or a treadmill test, a second dose of isotope is injected and second set of images are obtained. The rest and the stress images are compared to see if there's a difference in the circulation to the heart muscle, and also look for evidence of heart failure, heart scar, and heart function. And finally, the interpretation of these studies is done at a computer workstation, and reports are generated and sent to the primary doctors. And here's an example of a nuclear CAT scan along with a nuclear camera. So ladies and gentlemen, this is a quick overview of how a nuclear stress test is done and what are all the things that we can learn from a nuclear stress test, and how it is useful in identifying the presence of heart attacks, presence of reduced circulation to the heart muscle, overall heart function, and we can even assess prognosis based on these findings. I hope this has been useful to you, educational to you. Please do subscribe to our YouTube channel, and I will see you in the next presentation. Thank you so much for watching.